Hello and welcome back to Lisa Moss Medicare. I do everything Medicare. Now, I don't work for the federal government and I don't work for the Department of Medicare. What I do is I am an independent agent. There's 8 companies in our area. I work with 7 out of the 8 of them and write 23 of the 24 policies. So I look at and review all of your statistics and what you're looking for to find the best policy, the best company for you. I also do a lot of Medicare education, and that's what this channel is all about, is to help you with education on Medicare. Now, I have a comment section that you can actually comment online if you'd like to, and you can also call me. I just put it on the screen. It's 208-544-5011. And if I'm not licensed in your state, I'll find somebody that's qualified and really good for you in your state that is licensed. I also have a huge body of information on the website insuranceover65.com that you can take a look at and read all the articles that I talk about on YouTube in these live events every week. They're also listed, most of them, on that channel as well. So let's dive into it today. How to prepare for Medicare policy changes. So I want you to stay informed because Medicare plans change every year. Remember, anybody that has a supplemental insurance, it goes the same throughout the year. You may get notification in the middle of the year that your price goes up, but it's going to stay the same. The policy itself does not change. If you're on an F plan, a G plan, an N plan, whatever supplemental policy you're on, it doesn't change. However, your standalone drug plans and your Medicare Advantage plans, they start at the beginning of the year, January 1st, and they go to the end of the year, December 31st. And then the company can change the policy for the following year. And we're going to see a lot of that this year. They're calling this year as the big disruption year. We haven't seen anything like this in the last 2 decades of Medicare. So we're going to see a lot of changes this year. And I wanted to give you a guide on how to prepare, how to stay informed, and how to ensure that you receive the correct information for your health care. The first thing is you're going to receive a letter. It's called the ANOC letter, the Notice of Change letter, and your company is responsible for sending that letter out. Almost all the carriers send it out at the end of September. Be sure to keep that letter because if there's big changes or if your policy isn't being renewed for 2025, then you're going to have to change to a different policy. And to have that annual notice of change letter is super important, especially if you change and you want to go back to a Medicare supplement. It's one of the only ways to get back to a supplement. So make sure you keep that letter. Read that letter as well. A lot of people just throw it away. So make sure you keep it and read it because they're going to tell you if there's any increase in your premiums or your copays. They're going to tell you if there's changes to the drug formularies. I really expect we're going to see some changes this year, especially in adding drug deductibles. And they have to tell you that in your letter. They're also going to tell you about your provider networks. Like we have 3 different networks here in the area that I am in. Some of the policies have left behind. Some of the networks are only in 1 network instead of 3 networks. So you want to know that to make sure your doctor and all the doctors that you use are still in the network of your policy. Now remember, you can change your policy from October 15th through December 7th. And we as agents, we can let you know after the 1st of October what the changes to your policy are from 2024 to 2025. But your ANOC letter that's coming in the mail will also say that. If you don't receive that letter by the middle of October, call your carrier and let them know and have them send you another letter. It's also posted online most of the time, especially with the bigger carriers. So that's what you're looking for, is this letter that tells you if there's any premium changes, any copays changes, any deductible changes, any formulary changes for your drugs, and any network for your provider changes. So that's the first thing, one of the most important things to know. You also to understand your enrollment periods. Some of you live in states that there's a disaster zone. There's fires. We have a few in our state. There's other states such as California, they've always got them. So you can change your policy all year round. If you don't have that, your open enrollment period for your drug plans and for your Medicare Advantage plans, again, October 15th through December 7th. So check in with me, or if you have an agent that you already utilize, check in with them. If you don't have an agent, make sure you do call me so we can go over what your changes are and if you want to do anything with your plan. If you don't do anything, it's going to roll over. If your plan's been discontinued, then you won't have a plan for 2025. There is a grace period, though, that you can change if your plan is being lost, and that goes in after the December 7th. And also, you can change if you have Medicare Advantage. You can change one more time, January 1st through March 31st. So just remember those dates. It's really important to read your letters and decide if you want to stay with your plan or if you want to switch over to something new, and make sure that you do it within those time frames. Those of you that are on dual enrollments, Medicare, Medicaid, and your full dual enrollment, you can change once every quarter in 2024 and even more in 2025. So those are on the Medicaid website. So you have a little bit more flexibility when you can change, but make sure that if you're on Medicare, Medicaid, you're on a plan that's fully integrated. That means they work both with Medicare and Medicaid to help you coordinate your plan. In the coming years, we're going to find that those companies that don't coordinate the plans, you're not going to be able to have plans with them. In our area, we have Blue Cross and we have Molina, which are great, and they coordinate your plan. So if you have Medicare, Medicaid, you probably don't want to be on a plan that's not a coordinated plan. You also want to confirm your provider network status. So you want to check in with your doctor, check in with your specialist and your health specialist in hospitals to make sure that they're still in your network. Say if you're with Humana, United Healthcare, Pacific Source, that those networks haven't changed. You can also check in with me. I'll put my number up here again, the banner for my phone number. If you want to check in with me, you can email me through my website or you can call me directly. So you want to make sure that all your providers are still within your network. Again, we're going to get lots of changes coming up for 2025. So you just want to stay informed and know what your choices are, because remember, you're the consumer. You're the one that's worked all these years for your Medicare and you're paying for your Part B. So to have that education and to know what your choices are is really important. If you are in a network and your provider of your healthcare says a certain medication or a certain service they deny coverage, remember, you have the right to appeal. You can appeal up to 3 different times. If it's denied, make sure that you act quickly. You do have time frames in order to appeal, and you can go back to one of my other YouTube podcasts, those live events. Remember, I don't have regular podcasts. They're all under live events. And I do have a section just there on denials and appeals, and it has a lot more information. I don't want to give you all the information on this video, because this is really on how to prepare for policy changes. But go back to that video if you get a denial, or you can call me again and find out what you can do. There's paperwork that you can send in for those denials. You do have options if your policy is not being updated for 2025 and they're not offering those. You can go back and get a Medicare supplement. It's going to cost you a little bit more. ours in our area run around 220. Some other areas are 150, some maybe up to 240. You're going to pay a little bit more, but you want to have some type of gap insurance. That's what your Medicare Advantage did for you. Because remember, when you sign up for Medicare, you get Part A and B. That's your red, white, and blue card, but it only covers 80%. So you either have a supplemental or a Medicare Advantage that covers that gap, that 20%. So if you lose your policy, you can go back and purchase just a gap policy, your supplemental policies, and go back to original Medicare if you choose to. It's totally up to you. It's kind of cool because you have a lot of choices, more so if your policy isn't being renewed than if it is. So again, check in with your agent. Make sure that you're getting all the right information for you. You want to also monitor the legislative changes. There's a lot that are changing in 2025 for your drug plans and some other changes that are coming up. I'm doing some talks in my area starting October the 2nd in all of Magic Valley that will tell you those changes. You can also come see me at the Magic Valley Mall. I'll be there all afternoons for the month of October, so I can give you those changes as well. If there's enough of people that want information, I can also do a Zoom education of the legislative changes and the changes that are coming up for 2025. One thing that you may think about is putting an emergency fund together too, just as costs are changing over the years and costs are rising. There are, with Medicare Advantage, those out-of-pocket costs, those deductibles, those co-insurance costs. So for specific services and medications, it's always nice to have a little bit put on the side for an emergency fund. Lastly, work with your agent, work with your broker. If you don't have one, call me. It's super important for any disruptions that come up and throughout the year. If you have questions that come up throughout the year, it's really nice to have somebody that you can call with questions. So I'm going to just check the comments real quick and see if there are any that came in. It doesn't look like it. I know a lot of people watch this afterwards and aren't here on the live feed. So please send me your comments if you're here in the live feed in the future or through my website, Insurance Over 65. And I'm really happy to help anybody with any type of Medicare. Have a beautiful weekend. Enjoy this fall weather that's starting to come in. And if I can help you in any way and anything in Medicare, please let me know. Thanks for watching. Bye-bye.